Absolutely. Thanks very much for including us in
Sure.
this discussion. So at VA, we're in the process of transforming the model from a provider-centered model of care to a patient-centered model of care. And what we're doing really is trying to empower the patients, in our case it's the veterans, the 6 million unique veterans that we see every year, with, you'll be surprised, some low-tech, low-touch solutions that really turn that model on its head. Let me give you a specific example. You said yourself you're looking forward to the day where you don't have to fill out that stupid clipboard every single time you go to a doctor,
That's right.
Well, the VA...
What was that operation I had 15 years ago again?
You bet, you bet. And from your provider's perspective, he doesn't like it any better than you do,
Right.
because you're not remembering all your medicines, you're not remembering all your allergies, you may not be remembering your operations.
Absolutely.
So what have we been able to do at the VA? Well, we've offered this new kind of personal health record. It's different than the clinical one, different than the thing that
Right.
Michael was describing, where he and I work very closely together. But we have this new thing called the Blue Button, which is a personal health record that's been used by over 900,000 people, that is going to be available before the end of the year to every single federal employee, where we have private sector partners like Aetna, United Health, Blue Cross Blue Shield are going to make the Blue Button, make this personal health record available to all of their subscribers as well.
Wow.
Well, what does this mean to you? It means that the days of the clipboard are numbered. It means that you're going to have this central repository from your provider, whether it's the VA, the MHS, Aetna, Blue Cross, Kaiser, for example.
Right.
Those kinds of private sector partners are either already have or are about to announce the availability of their records. And what this means to us is that we're moving from a world where you have proprietary systems that are closed, isolated, very, very difficult, very expensive, to open systems that are openly architected, modular, and standards-based.
Wow. Cool.
And what we're solving is the problem of interoperability, creating a regime where the data itself is in a form where human beings can read it, where the doctors can gain access to it, and where we can do this safely, securely, and privately. It's a very, very exciting time.
Man, it is an exciting time. And but what about, Dr. Levin, what about ex-federal employees? Can I get a Blue Button too?
Well, it depends on who your provider is. So if you're with one of the national providers, the answer is probably yes. And if you're with one of the regional providers, you ought to be asking them.
Wow.
I get the opportunity, the privilege of doing these kinds of discussions a lot. And the ask that I always make is make sure you're talking to your doctor. Make sure you're going there and you're saying, hey, listen, I want my electronic records. I love the services that you're providing. I trust you as my clinician, but I want to be able to see it. And if the answer is absolutely yes, here you go, maybe they're going to call it Blue Button. They're probably going to call it something. Then you're in business.
Cool.
If the answer is no, you need to have a different discussion.